All right, welcome. If you're a nursing student prepping for your PEDS rotation or you're deep in study mode for the NCLEX, you are in the perfect spot. Today, we are going to break down absolutely everything you need to know about health promotion for toddlers, so from ages 1 to 3. Think of this as your ultimate study guide. So here's our game plan. We're going to start with a big picture overview of toddlerhood, then we'll walk through all those major physical and developmental milestones. After that, we'll get into their head a bit, their inner world, before we jump into our crucial role as nurses with health, nutrition, and safety. And you know we have to finish strong, so we'll test our knowledge with NCLEX-style questions and then wrap it all up with a clinical challenge. Okay, let's just dive right in. The toddler years, wow, they're this incredible and, let's be honest, kind of chaotic time. It's just a whirlwind of growth and this constant push for independence. For us as nurses, getting this stage isn't just about memorizing facts. It's about having that deep insight to really guide families and make sure these little humans are thriving. All right, first things first. Section 1 is all about the basics, the key physical changes that really define what a toddler is. Think of these as the fundamental numbers, the markers you'll be looking for in every single well-child visit. Okay, so let's break this down, because these numbers are your bread and butter. First, that anterior fontanelle, the soft spot on their head, should be closed out by 18 months. That's a huge sign of normal skull development. By 30 months, so 2.5, they should weigh about 4 times what they did at birth. Now, you'll notice the growth rate actually slows way down from when they were babies. We're looking for about 4 to 6 pounds and 3 inches a year. And this last one is super important. Their head and chest circumference should be about equal by age 1 or 2. If that head is still a lot bigger, well, that could be a red flag we need to look into. So, we've got the physical growth markers down. But what does that growth actually look like in action? In this next section, we're going to chart the incredible progress toddlers make in how they move, talk, and interact with the world month by month. Okay, check this out. At 15 months, you're seeing those first wobbly, independent steps, and they're using their fingers to eat. Language is just budding, maybe 1 or 2 words. But then, just 3 months later at 18 months, look at that jump. Now they're walking without any help, they're scribbling, trying to use a spoon, and saying more words. They can even follow a simple command. This just shows you how fast everything is happening. They're not just moving anymore, they're really starting to interact with their world on purpose. And the explosion just continues. By 24 months, so age 2, they're running, kicking a ball. Language takes a huge leap forward with 2-word phrases, and you can see their little brains working. They're starting to problem solve, figuring out knobs and buttons. Then, at 30 months, things get even more refined. They're jumping with both feet, turning pages one by one, and their vocab is up to around 50 words. This is also when that magical world of pretend play really starts to open up, and they can follow more complex 2-step directions. So, we've seen what they do. But to really get it, we need to understand why they do it. Section 3 is where we dig into the key theories from Piaget and Erikson that explain the fascinating inner workings of a toddler's mind. This slide puts the 2 heavy hitters side by side. So on the cognitive side, Piaget says they're in the preoperational stage. What does that mean? Well, for one, they're egocentric. They literally cannot see things from another person's point of view. It's also why they love to copy you doing chores. We call that domestic mimicry. Then, on the psychosocial side, you have Erikson's autonomy versus shame and doubt. This is the core battle. Their entire being is driven by this need to be independent, and that's why their favorite word is often no. It's not just to drive you crazy, it's them testing their own power. And routines, that ritualism, that's their safe space in this confusing world they're trying to control. So here's the bottom line. If you need a memory anchor for this whole phase, just think of it as the me do it stage. Seriously, that one little phrase perfectly captures Erikson's whole idea of autonomy. They want to put on their own shoes, feed themselves, press every single button, because they're figuring out that they are their own person with their own will. Okay, let's bring all this theory into the real world. Section 4 is all about our job as nurses in promoting health. We're going to cover the absolute essentials of nutrition and the top priorities for keeping these curious toddlers safe. Nutrition can be such a huge source of stress for parents. So the first thing to teach is this idea of physiologic anorexia. It sounds scary, but it just means it is totally normal for a toddler's appetite to drop because their crazy fast growth rate has slowed down. Reassuring parents about this is key. And then stick to the guidelines. 16 to 24 ounces of milk, keep the juice limited, and use this easy serving size rule, 1 tablespoon for every year of age. And safety, well, that's non-negotiable. That list of choking hazards is critical, and the golden rule is you always supervise meals. No eating while running around or lying down, period. As these little ones get more mobile, their world gets a lot more dangerous. Our job is to provide what we call anticipatory guidance, helping parents see the risks before they happen. This slide hits the top 5. Burns, check that water heater temp and cover outlets. Drowning, constant supervision. And yes, even keeping the toilet lid closed is a safety measure. Falls are a big one, so gates on stairs and locks on windows are a must. For poisoning, lock everything up. And in the car, it's simple. They stay rear-facing until they're at least 2 or hit the seats limit. This is life-saving information for every family. All right, you've been soaking up all this foundational knowledge. Now it's time to put it to the test. In Section 5, we are shifting into full-on NCLEX prep mode to see how well you can apply this stuff in a testing situation. Okay, here's our first question. The focus is an 18-month-old. Look at these options and think back to those milestone charts. Which of these skills should we expect to see at this specific age? Go ahead and hit pause right here. Really think it through before we break it down. That active recall, trying to pull the answer from your brain, is one of the absolute best ways to make this information stick. Okay, let's walk through this using the clinical judgment model. First, we recognize the cue. The age is 18 months. Simple enough. Next, we analyze. What do we know about 18-month-olds? We know removing clothes, jumping, and turning single pages. Those are skills for an older toddler, closer to 30 months. But attempting to use a spoon? Yes, definitely expected. And walking independently? That's a hallmark 18-month skill. So the correct answers are B and C. See how we just systematically knocked out the wrong answers? That's the process. Let's try another one. This time the question is a little different. We're checking to see if a guardian actually understands what we've taught them about their 2-year-old. So, which one of these statements shows that they're on the right track? The breakdown here is pretty straightforward if you know your milestones cold. The key is 2-year-old, which of course is 24 months. Turning pages one at a time, turning a doorknob, having a 50-plus word vocabulary, all of those are things we expect from a 30-month-old, not a 24-month-old. But kicking a ball? That is a classic 24-month gross motor skill. So statement A is the one that shows correct understanding. And here's a huge tip for your exams. Milestone questions are all about precision. The NCLEX loves to see if you can tell the difference between these closely spaced age markers. So if you can confidently say what the key skills are for 18, 24, and 30 months, you are going to be in fantastic shape. All right, for our last section, we're moving beyond multiple choice and into a real-world scenario. This is your chance to pull everything we've talked about together and really think like a nurse in a clinical setting. So picture it. You're in the exam room. You've got a 2-year-old toddler and their family right there in front of you for a routine checkup. You've done your assessment, you've gathered your data. Now it's time to teach. Here is your task. Based on this child's age, you need to put together a teaching plan. So first, what are their cognitive and psychosocial stages? Second, what are 3 key things you're going to teach them about nutrition? And third, what are your 2 top teaching points for preventing burns and drowning? Think back on everything we just covered. And now for the final thought that ties it all together. You've identified the stages, you've planned your nutrition talk, you've highlighted the safety risks, and you've delivered your teaching. The family seems to get it. So what would you do next? How do you really close out that visit and make sure your teaching was effective? That is the heart of clinical judgment. Because at the end of the day, confirming understanding and building that partnership with the family is what toddler health promotion is all about. Thanks for joining me on this explainer, and as always, keep thinking critically.